We begin today's program by checking in with Niagara's Medical Officer of Health, Dr. Mustafa Hirji. Let's talk about your concerns about the recent numbers. We've seen a steady increase across the province and also, more importantly, right here in Niagara.
Unfortunately, I think while the numbers are going up in Niagara, they're going up much more markedly elsewhere in the province, particularly in the GTA and in Ottawa. And I think that's quite concerning to all of us, particularly with schools restarting, because of course, if you have more cases in the community, you could get more cases in schools. A big link that we're seeing across the province is that social gatherings are a big driver of some of these cases, which is why we had the recent announcement by the province to try and start to curtail that.
You were hoping that Niagara might have been part of those new restrictions that Premier Ford announced late last week, but Niagara was not included in the scale back of those numbers for gatherings.
Yeah, so Niagara wasn't included in the original announcement, which came out on Thursday. There's actually a lot of discussion after that by several medical officers of health, including myself, that we probably should be part of this as well, because if there's a risk of infection spreading in gatherings in Toronto, there's no reason why it can't happen here in Niagara. As well, if gatherings of that size can't happen in Toronto or in Peel or Mississauga, people might actually just transplant them down to here. And now we're actually going to have these cases and that's risk of infection transported here. The final thing is that one of the key roles we do in public health is we're trying to, after every person is diagnosed with COVID-19, we're finding all of their contacts. And what we're finding is with large gatherings, we're having so many more contacts, it's starting to stress our ability to do that work as well. And that's really important for making sure we keep infections low in our community.
Dr. Hirji, with the increase in numbers across the province, can we say now that we are heading towards or are already in our second wave of COVID-19?
I think if you're looking province-wide, we're now actually at about 50% of where the cases were in Ontario back in the peak of that first wave. So that's certainly a worrying sign. What we are seeing, though, is the cases are very concentrated right now in the Toronto area and in Ottawa. In Niagara, we've definitely seen probably a doubling of our cases at least, but it's not overwhelming yet. And so I think the risk is maybe not quite as high yet. I think the really key thing going forward, though, is doing what we can to start to bring those numbers down. So, of course, gatherings are linked to spread. We now have new restrictions on that, so hopefully that'll help. But the other part is what we all do in terms of our own personal behavior, that we're keeping 2 meters distance from each other. We're washing our hands frequently, wearing those face coverings when we're indoors and when we can't keep distance outdoors, and really paying attention to our health so we know if we have symptoms, we're getting sick, so we know to stay home so we don't spread it to anybody else and get tested.
The Thanksgiving weekend is coming up, and that's going to be very difficult to convince a lot of people not to have those family gatherings.
Yeah, no, it'd absolutely be a challenge. I think we want to have people still spend time with their families and have those really important events. I think the way we encourage Thanksgiving this year is that you have your Thanksgiving event with really just your household or maybe just your very closest inner circle of the family, so it's not a very large group. And I think that's a way that we can find that balance where we're not creating the risk of infection spreading, but we can really celebrate that nuclear family, which is so important.
On September 8th, schools started to open up across the province, but since then, we've now seen only 2 weeks in cases of COVID at a Welland High School and also at an elementary school in Niagara Falls. How much of a concern is this for you as the Medical Officer of Health?
We never want to see any cases in schools. However, it was always inevitable that we would see some cases in our schools. 15% of people in Niagara are either a student or a staff person in schools. So if you have cases in the community, you can expect 15% of those are going to end up in the schools. And so it was inevitable we'd see some cases. I think the big question is how low can we keep that number? And the lower we keep cases in the community, the lower it's going to be in our schools. Right now, of course, the vast majority of students are able to attend school and aren't affected by what we've seen in a couple of schools, and hopefully we'll be able to keep it that way.
Dr. Hirji, thanks for your time today. We'll try to check in with you in the next few programs in the future. Thanks for your time.
Sounds good. Thanks so much for having me.